Currently, ventilators are split in a passive way, which means you take one ventilator, you literally split the tubing and route it to two patients. This means that you don't have independent control over the ventilation parameters for each of the patients, and it presents what can be a very dangerous situation. People try to do this in desperate situations and try to match patients as closely as possible in terms of their size and pulmonary mechanics, but there are a lot of reasons why this can cause problems. We've been working on a solution to this using pressure regulators, which is an off-the-shelf technology that's used in a lot of different industries that, with the way that we've developed to put these things together, can help independently control the ventilatory mechanics for each patient to improve upon the passive standard and make this technology potentially safer. Again, I'll reiterate, this is still very experimental. None of this should be used in the treatment of patients at this point. Okay, so now I'll give you a brief overview of the design that we've come up with to try and achieve these goals. So what we have here is a standard anesthesia machine, which includes a ventilator as a part of it. And I'll just sort of walk you through from the anesthesia machine or the ventilator all the way through all the components to our two simulated patients. So first, the anesthesia machine, we can see overall data about the ventilation that we're providing. So we can see information about the tidal volumes that we're delivering. We can see information about the pressures that we're setting, the respiratory rate, and we can see the typical flow and pressure curves that you would expect to see on any ventilator. So coming out of this ventilator, we have our inspiratory limb and our expiratory limb. And you'll note at the inspiratory limb, there are one-way valves, followed by the standard ventilator filters. And these are oriented in the correct direction for inspiration and for exhalation. In particular, the valves are also important for decoupling the pressure regulators. It's an important detail that we'll discuss in the paper that we're going to write about a circumstance which is somewhat rare but could be potentially very problematic for patients. But again, these one-way valves in this position address this issue. So from here, continuing down the inspiratory and expiratory limbs, we have our two pressure regulators on the two inspiratory limbs for what we call patient A and patient B. So these pressure regulators have a standard Phillips head screw that adjusts the pressure that's allowed to be sent through to our simulated patients. And I'll show you a demonstration with that in a minute. We have another filter and another one-way valve. Again, this is important because we don't want these pressure regulators to become contaminated with anything from the patient themselves. So downstream from these pressure regulators, we do have two gas flow analyzers here, which allow us to measure the tidal volumes and pressures that we're delivering to each patient independently. This is very important. You don't necessarily need these specific components, and there are other components which would be cheaper that could achieve the same goals, but you need downstream monitoring because pressure regulators don't have any kind of intrinsic monitoring to give you information about what you're delivering to the patients. You need this information to be able to make adjustments to the pressure regulator to make sure that you're delivering what each patient needs. So now I'm going to take you through just a quick demonstration of how you can use these pressure regulators to independently control some of the ventilatory parameters for each of the patients in this simulation. I'll start off by just showing you the overall ventilator settings and the feedback that we're getting from the ventilator, and then we'll go through each of the patients and what that looks like. First and foremost, the ventilator needs to be in pressure control mode. With pressure control mode, you specify an inspiratory pressure, and we're doing that here by setting the pressure to 40. The number doesn't necessarily have to be exactly 40 or any specific number, except that it must be at least the pressure that the patient with the highest demand requires. The respiratory rate and the PEEP, the inspiratory time, those will all be shared across the two patients. So it is important that their needs for those parameters are relatively matched. You'll notice the feedback that you get from this, we're getting an overall tidal volume, which represents how much we're ventilating the whole system of both patients. And we're also getting a peak pressure back. And if you notice, the peak pressure is lower than the inspiratory pressure that we're setting. And that is actually because this peak pressure will always be equal to the pressure at whichever pressure regulator is set the highest. So this is normal and expected behavior for the design of our circuit. So now I'll show you actually moving through each of the patients individually and show how you can make adjustments to independently control the tidal volumes and pressures that you're delivering to each of these patients. So if you look down here, looking here, we see information about how we're ventilating each of these simulated patients. And right now I have these set to fairly extreme settings, not even necessarily a clinically realistic ventilation, but showing that if we can do this, then actually clinically realistic ventilation parameters are very achievable. So we can see that this patient is receiving a tidal volume of only about 100, and that's at a peak inspiratory pressure of a little less than 15. This patient here, and you have to zoom in a little bit to see, is getting a tidal volume of about 500, and that's at a peak inspiratory pressure of about 33. And if you note, that matched what our ventilator was saying the peak pressure of the overall system was. So I can take a standard Phillips screwdriver, and if I adjust this screw here, I can cause this pressure regulator to increase the pressure. And as I do this, you'll notice that the pressure and tidal volumes change. So I'm just going to start opening this pressure regulator. And as I do, you can see that parameter change on the screen. So now we're delivering about 300 for tidal volume, now about 466. And I can reach a point where both these patients are roughly matched, and now getting about the same tidal volume. And on the ventilator, I'm seeing again the summation of the ventilation between these two. But notice that even though this patient has gone from about 100 to now about 500 cc's of tidal volume, this patient's tidal volume barely changed. It's still approximately 500 cc's. And if I decide that I need this patient now to receive less ventilation, I can do the opposite. And as I do this, this patient's tidal volume will begin dropping, and I can titrate this to whatever tidal volume is necessary to then ventilate this patient. So by using these pressure regulators, this allows us to independently determine a tidal volume for each of these patients using just one ventilator in pressure control mode. And finally, special thanks to David Holcomb and Rick Seatman with Maxitrol, helping us modify their gas appliance pressure regulators, the R600S model, and helped customize a spring for us that would achieve the pressures that we needed. Most of all, thanks to everyone out there on the front lines that's trying to help us all get through this pandemic.